الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Adolescence Health by Professor Mahmoud Hani Sulaiman. General considerations. Introduction. Adolescence is a critical period of life, marked by biological, social, and psychological changes. Biological, social, and psychological. These are formative years of behavior and activities relevant to health. Period of major transition. Adolescence is a period of major transition during which one learns to become adults. One benefit from guidance on human biology, health, disease, and behavioral adaptation. Bulk of morbidity and mortality in adulthood is due to health behaviors like smoking, alcohol, exercise, and diet, which is developed during adolescence. Health issues concerning adolescence are growth, development, sexually transmitted disease, respiratory tract infections, drug, alcohol, and tobacco abuse, teenage pregnancy, abortion, suicide, homicide, and issues of behavioral problems. All these are concerning adolescence. Growth and development, sexually transmitted disease, respiratory tract infections, abuse of drug, alcohol, and tobacco, teenage pregnancy, abortion, suicide, homicide, and behavioral problems. Definition of adolescence. Latin word adolescere, to grow to maturity. Adolescence means to grow to maturity. Adolescent considered to be no longer child and not yet an adult. Chronological definition of adolescence kept broad, so it is used in variety of sociocultural and health settings. WHO defines it as adolescence as 10 to 19 years old, youth as 15 to 24 years, young people as 10 to 24, adolescent divided into two phases, early between 10 and 14, late adolescent 15 to 19. Causes to focus on adolescent health. Adolescents face serious health challenges. Adolescent health and development affect economic prosperity. Investing in youth helps to break cycle of poverty. Health is key element of overall youth development. Young people have an equal right to health. It is a special group with special needs. Why? Because of their number, large percent of the population. Adolescence is the period of rapid physical growth, sexual and psychological changes. Habits and behavior picked up during adolescence, like risk-taking behavior, substance abuse, eating habits, conflict resolution, have lifelong impact. Adolescence is the last chance to correct the growth lag and malnutrition. Many adolescent boys and girls are sexually active but lack information and skill for self-protection. They have simple but wide pervading crucial reproductive health needs, menstrual hygiene, contraception, including emergency contraception, safety from sexually transmitted infections and HIV, communication gap exists with parents and other adults. Some basic physiological and psychological needs during adolescence. Growth and development. Early part of adolescence is showing rapid physical growth, changes in psychological functions and organ systems of body, and completion of sexual development. Marked hypothalamic pituitary gonadal system becomes mature. Ovaries and testes produce enough steroid hormones which result in growth of genital organs and appearance of secondary sex characters. Growth and development 2. Increase strength and efficiency of body energy production. They are exceedingly large within same individual and between different individuals. Puberty in females is earlier than males. Some adolescent boys and girls are sexually active but lack information and skills for self-protection. They have simple but wide reproductive health needs, menstrual hygiene, contraception, safety from sexually transmitted infection and HIV, as we said before. Nutritional needs of adolescents. Adolescents in developing countries suffer from malnutrition and dietary imbalance, while in developed countries have problems of obesity. Adolescents have greater nutritional requirements due to rapid growth and physical activity level. During this period of adolescence, gain 50% of their adult weight, more than 20% of their adult height, and 50% of their adult skeletal mass. In undernourished children, rapid growth during adolescence may increase severity of undernutrition. Continued nutritional needs in adolescence. Iron is deficient in almost all age groups. Menses create more vulnerability for girls. Factors interfere with nutrition are inadequate food supplies in quantity and quality, psychological factors affecting appetite, food fads and cultural attitudes, infections and parasitosis. Psychosocial needs of adolescents. Adolescence is a period of change and consequently of stress, characterized by uncertainties in regard to identity, position in peer group, in family, in society at large, and in context of one's own responsibilities as an adult. Compulsions of parental approval often conflict with emerging aspiration for independence. Their behavior guided by intense desire for independence and identity. In process, adolescents undergo intense psychological stress and personality change. Sociocultural factors affecting development. First, in most parts of the world, especially developing world, girls are deprived of nutrition, access to health care, opportunities for education and employment. Girls taken out of schools when they reach menarche. In most traditional societies, from the very beginning of life, girls are groomed to accommodate male-dominated society, with rising proportion of children attending school and ever-increasing functions of education, opportunity to facilitate healthy development of adolescents opened up in many developing countries. Continued sociocultural factors affecting development of adolescents, increased urbanization, globalization, cosmopolitan type of population, explosion of information technology, and changing social and cultural values in evolving society affect psychological development of an adolescent. Health problems of adolescents are not discussed with parents and health professionals due to lack of privacy and confidentiality. Some remain either unresolved due to rapid biological, psychosocial changes, impulsivity, emotional and risk-taking behavior, putting them at risk for problems. Continued sociocultural factors like sexually transmitted diseases, respiratory tract infections, accident, drug, and psychological and mental health disorders. Healthcare systems have provided for health of children and adults, but adolescents are left out without any specific health program directed for them, especially in developing nations. However, lately, this special group of population was given attention in post-HIV period as adolescents constitute highly vulnerable group. Behavior-related health problems. Alcohol, smoking, and drug abuse. Adolescents tend to experiment with alcohol, smoking, and other drugs. Use of tobacco, alcohol is widespread in both developing and developed nations. Up to 50% of high school students in USA use marijuana as an accepted way of life. In Sweden, drug dependence peak in age of 12 to 20 years. Factors for smoking among them are peer pressure, following example of sibling and parents, and employment outside home. Tobacco. 440,000 premature deaths per year in US due to cancer, cardiovascular disease, respiratory disease, cerebrovascular disease, which all have relation with tobacco. $150 billion in health-related costs. By far, the most preventable cause of death in the United States is tobacco use. Tobacco and cancer, 70% of all lung cancers due to tobacco, 30% of all cancers due to tobacco. Organ-specific carcinogens in tobacco smoke. Lung and larynx. The cause, the carcinogen, is polycyclic aromatic hydrocarbons. Polonium, 210, 4-methylnitrosamine, 1,3-pyridyl, 1-butanone, NNK. Esophagus, nitrosamine, NNN, pancreas, NNK, probable, bladder, 4-aminophenyl 1,2-naphthylamine, oral cavities, smoking, polycyclic aromatic hydrocarbons, NNK and NNN, oral cavity snuff, NNK, NNN, and polonium. So, tobacco smoke is a cause of cancer in lung, larynx, esophagus, pancreas, bladder, oral cavity through smoking, and oral cavities through snuff. Relative risk for current smokers of cigarettes. It is high as it is shown. So the risk for current smokers to cause coronary heart disease, cerebrovascular lesions, cancer, it may reach in lung cancer 23 relative risk for lung cancer. So it is a high risk of smoking to cause coronary heart disease, cerebrovascular lesion, aortic aneurysm, chronic airway obstruction, cancer of lip oral cavity, pharynx, esophagus, stomach, pancreas, larynx, lung, cervix, and kidney. Cigarette and workplace. Similar to asbestos exposure, cigarette smoke is synergistic with radon decay products in causing lung cancer. Cigarette smoke exacerbates bronchitis, asthma, pneumoconiosis associated with exposure to silica, coal dust, grain dust, cotton dust, and welding fumes. Synergistic, synergistic with all of these. Definition of alcoholism. Many people living in denial are violently opposed to defining alcoholism at more than 2 drinks per day, either 2 beers, 2 wines, 2 shots. Truest definition of alcoholism is subjective but involves impairment and degradation of family and social relationship. Impairment and degradation of family and social relationships. Most alcoholics deny, so their brain power proves they are not alcoholic. Blood level of alcohol and the effect. At 20 mg per deciliter, decreased inhibitions and slight feeling of intoxication. 80, decrease in complex cognitive functions and motor performance. 200, obvious slurred speech, motor incoordination, irritability, and poor judgment. 300, light coma, depressed vital signs. 400, it will cause death. This is the metabolism of ethanol. Alcohol at clinically important alcohol concentration, microsomal and ADH enzymes are saturated, i.e. metabolism proceeds at a constant rate and is independent of alcohol concentration. Excess of NADH over NAD stimulates lipid biosynthesis. Legal intoxication is 0.08%. Legal intoxication is 0.08%. Alcohol and liver. Fatty change present in more than 90% of chronic drinkers. Liver enlarged but patient is asymptomatic. Changes are reversible with cessation of drinking. Macrosteatosis, inflammation or necrosis. Alcohol hepatitis. Only between 10 to 15% of alcoholics will develop hepatitis. Alcoholic may have systemic symptoms and jaundice. Hepatocellular necrosis with Mallory bodies, PMNS, central hyaline sclerosis, thought to be a precursor of cirrhosis, alcoholic cirrhosis. So fatty change, alcohol hepatitis, and alcoholic cirrhosis. Fatty change biochemistry. Catabolism of fat by peripheral tissues increase, and there is increased in delivery of free fatty acids to liver. An excess of NADH, as we said before, over NAD stimulates lipid biosynthesis. Decrease of oxidation of fatty acids by mitochondria, we said before. Acetaldehyde forms adducts with tubulin and impairs function of microtubules, leading to decreased transport of lipoproteins from liver. Neurologic symptoms and signs of alcoholism. Wernicke syndrome and Korsakoff syndrome. Wernicke syndrome and Korsakoff syndrome. Korsakoff syndrome is much important. Memory loss and confabulation due to thiamine deficiency and direct toxicity. Mechanism of disease caused by ethanol abuse. The liver, okay, fatty change, acute hepatitis, alcoholic cirrhosis, as we said before, due to toxicity. Nervous system, Wernicke syndrome and Korsakoff due to thiamine deficiency, toxicity and thiamine deficiency. Cerebellar degeneration due to nutritional deficiency, peripheral neuropathy due to thiamine deficiency. Cardiovascular system, cardiomyopathy due to toxicity, hypertension due to vasopressor effect of alcohol. Dietary habits in adolescence. Bad dietary habits in adolescence are common. They tend to consume junk food and imbalanced diet more than any other group. They may develop habit of compulsive eating at one end and anorexia nervosa at the other end of the spectrum. Sexual behavior, indiscretion, sexual indiscretion, lack of education on skills of responsible sexual behavior lead to many problems. Unplanned pregnancy, sexually transmitted disease and HIV, unmarried mothers, illegal abortions, psychological breakdowns, and complex social problems. Risk-taking behavior in adolescent. Adolescent males tend to challenge difficulties without taking danger into account to the extent that most adults would. This impulsive risk-taking behavior has implications for health of adolescents, whether activity is driving, sports, any work or various health-related behaviors like drugs, alcohol, or sexual urge. Adolescent health, what is the global scenario? Health adolescents measured by studying age-specific morbidity, mortality, prevalence of behavioral disorders. This relatively healthy phase of life must also be seen in light of barriers to health-seeking behavior and underreporting of adolescent-related data in developing countries. However, DALYs found to be most suitable indicator for purpose of international comparison. More than one-third of disease burden, about 60% of premature deaths among adults associated with behavior or condition began or occurred in adolescence. For example, tobacco and alcohol use, poor eating habits, sexual abuse, and risky sexual behavior. Adolescence-related risk factors are a greater problem in wealthier countries due to relatively greater impact of smoking and bad diet in those countries. However, prevalence of these risks is expanding rapidly in many low and middle income countries. What are the public health implications of adolescent health? On mortality in adulthood, integrational effect, adolescent sexuality, adolescent pregnancy, and risk-taking behavior. Print this table and use it. Principles of health programming for adolescents. It must recognize the diversity of youth age group, involve young people, design comprehensive programs, make health services youth-friendly, address gender inequality of women, address needs of boys, address non-health factors that influence health, address underlying risk and protective factors. وفي النهاية أقول الحمد لله رب العالمين و thank you for your good listening.